Hey, DNA. Welcome to All Access DNA. I'm your host, Kate Wilson. In honor of American Heart Month, we are talking about inherited dilated cardiomyopathy, or DCM. If you missed last week's episode with Greg Ruff and his personal diagnosis of inherited DCM, please check out episode 8, Should I Consider Genetic Testing for Dilated Cardiomyopathy? For today's episode, we are talking to someone whose life and profession has been impacted by dilated cardiomyopathy. Dr. Susan Weiss Liebman is a molecular geneticist who is one of MIT's early female undergraduates and currently studies prions and human protein misfolding diseases such as ALS and Alzheimer's. Dr. Liebman recently published her memoir, The Dressmaker's Mirror: Sudden Death Genetics and a Jewish Family's Secret, which is a love letter to her family. When her 36-year-old pregnant niece suddenly collapsed and died, Dr. Liebman searched for answers, which ultimately culminated in the discovery of a previously unknown heart disease gene. Our conversation explores the heritage and legacy we leave our families, as well as how culture and genetics shape us. Let's get started. Welcome, Dr. Susan Liebman. Thank you so much for being on the podcast today.
Hi, Kate. Thanks so much for having me. I'm looking forward to chatting with you.
Same. So I wanted to talk to you. I know that you recently published a memoir, and I recently read it, and it's titled The Dressmaker's Mirror: Sudden Death, Genetics, and a Jewish Family's Secret. And I wondered if you could tell us maybe just a little bit or a summary of what inspired you to write the memoir.
Well, actually, several things inspired me to write the memoir. I wanted to leave something for my children and grandchildren to tell them about my life and experience as a woman growing up in Brooklyn and learning about becoming a scientist at a time when it wasn't so common for women to be scientists. It was a chance for me to write a love letter to my family as well. But at the same time as I was doing that, I was very involved in a genetic search for a mutation that caused the death of my niece. And this parallel interest was going on for a while. So let me tell you about my niece. But what eventually happened was I married these two approaches, the love letter to my family and this genetic search. So I'm a geneticist. And what happened was that my niece, who was 36 years old at the time, suddenly died. She was in a restaurant with her husband. She was 6 months pregnant with her first child, on top of the world, thrilled with everything, newly married. And just out of nowhere, she keeled over and was dead. And the autopsy at first showed, nobody murdered her. There wasn't any drug. There was, it was a natural death. They didn't have a reason. And the coroner was New York City coroner's office that I've been in contact over the years since then, was smart enough to take her heart and send it away for further analysis. And a few weeks later, the result came back that she had dilated cardiomyopathy. And I knew that fancy long word because my sister had been diagnosed with dilated cardiomyopathy about 10 years earlier.
And that's your niece's mother.
That my niece's mother. And they said that my sister must have gotten it from a virus. It was just the bad luck of complication of a flu. And they said that because there was no clear family history of dilated cardiomyopathy. So they said, just from the flu. Well, I'm a geneticist. I figured out that my sister, my niece have this. It's probably genetic. And so I set out to try to find the mutation and was lucky enough through my genetic contacts in Chicago as a yeast geneticist to engage Dr. Elizabeth McNally, whose husband was a yeast geneticist, in our case. And it took some years, but eventually she decided as part of her research to sequence my sister's whole genome because the mutation didn't show up in the known heart disease mutations at the time. and she was able to pinpoint the mutation. And then I started looking for family to try to warn them.
Of course.
So I was doing that at the same time as I was writing the memoir, and then I thought that genetic testing would become routine. Very soon there was a genetic revolution, but that didn't seem to be happening. And so I decided to write the book both about my niece and the search for the mutation, the family, and the need for genetic testing to educate doctors and patients that it is not that expensive anymore. It used to be $1 billion to sequence the first genome. Now it's under 500, and it can really save lives. So.
Yeah. And I think that's one of the things about the book that I found intriguing. As a genetic counselor, I've read a lot of different books about genetics, genes. Some of them are, more textbook-like, probably a little more dense. But this one, I could definitely sense the love letter to the family, because it talks a lot about family history and pulling together kind of the traditions, the culture, the other things you pass down, but interweaves it with the genetic information too that you pass down, knowingly or unknowingly, right? And so I thought that was an interesting way to present it, was sort of sharing all these things that go into a family.
I'd forgotten you were a genetic counselor. So are you still doing that?
Here and there. I'm mostly doing teaching right now, so I'm not seeing patients these days. The other thing too, I think that you mentioned, and that some people think of when it comes to like genetic research or finding genes or the genetic mutation, is that this is all stuff that was done a long time ago. And we know it all now, right? Because you said, the sequencing has definitely dropped for sure in cost, but there's still a lot of unknowns. So I think it did take, it's fortuitous that you had this connection with Dr. McNally and were able to kind of put some focus and being able to sequence your niece's genome, because I think people think, okay, there's kind of a handful of genes, but there's not. I mean, what we're finding out, especially with cardiac heart conditions, there's hundreds, potentially maybe more, that can impact people's heart health.
Yeah, there's more and more genes being found. And of course, we're only looking at the cases where a single gene has the major effect. But there will be more and more that are polygenic and where we need to know a whole lot of genes.
Right, and how the genes kind of interact with each other, so not just by themselves.
And I think one of the things that turns people off, as a genetic counselor, that when you find a mutation in a gene that is a smoking gun that has to do with the disease you're looking at, all you can tell people is that for sure this is just a minor change. Half the world has this change. It's benign. Or this is a bad mutation. It's pathogenic. We know a lot of families that have this mutation and they all have this disease. Mm-hmm. But then there's the stuff in between, likely benign, likely pathogenic, and then the fearful variant of unknown significance. We have no idea whatsoever if this is a good or bad change. And people feel sometimes, well, if you can't really tell me, why do it?
Right.
Why do it? Because you can get benign and pathogenic and you know something. You don't know everything. If you get variant of unknown significance, you have to wait for geneticists and scientists to give you that answer over time. But don't throw the baby out with the bathwater.
Yeah, because there could be things that are important to find out. And I think you covered it in part of the book, was talking about how, check in. Even if you've had genetic testing now, check in a few years down the road. And I think that has definitely, since I've been in clinic, 17-ish years over time, that's even evolved, because it used to be, okay, we've done the test, we've looked for the genes, but then once the human genome was sequenced and more became known, it was like, oh no, we may need to repeat or do some additional testing every few years as we learn more.
And even now with whole genome or whole exome sequencing, where your whole genome has been sequenced, but they didn't analyze it fully or correctly. As time goes on, they know more genes to look for. And so you still have to keep checking in on it. The other problem is people think that when they've done 23andMe or Ancestry, that they've done genetic testing. Oh, I did that.
Mm-hmm.
And that's not clinical genetic testing.
Yeah.
It's great to find out who your relatives are, and it's lots of fun, and maybe they'll tell you about one or two conditions, but it's a far cry from genetic testing, as you know.
Mm-hmm. Right. And for getting that clinical diagnosis, but that clinical reason. And there's different regulations. I'll just say that for the audience too, in place for companies that do certain diagnostic testing versus kind of more screening types of tests, I would say. In the dressmaker's mirror, like I said, it's and like you pointed out, it interweaves sort of these two discussions and parts of the family history. In writing it, pulling in some discussion of your family, your experience, being a female in science when there wasn't as many. But you also talk a lot about your Ashkenazi Jewish ancestry, passing down like cultural traditions, in addition to talking about genetic testing or finding this genetic condition in the family. So there are kind of a few different themes and stories running through the memoir. Is there a specific message that you hope readers take away from that? Or is there kind of like a feeling you want them to leave with after reading this book?
Well, of course, I want them to pursue genetic testing, to feel like they should do it themselves and they should promote it and change the laws so that it is better and easier for genetic counselors and for patients and doctors. But I also want people to not fear it, to understand that it is only like getting your blood pressure. It's going to give you a tool, something to look out for, not something to be frightened of, not something to feel it's, the end of your life, you have a mutation. Everybody has mutations. We all have different variants. And then if you do have an illness or a mutation that puts you at risk for a bad illness, I want people to realize that you can still have a wonderful life and that people live each day and enjoy each day and help change the world despite things that we have to live with, have to accept that are not the ideal thing that we might want in our life or for our lives. My father's, statement when he turned 50 that my bags are packed, I'm ready to go. I've had a great life and I couldn't ask for, I'd love to have more, but it's good enough, is some of the message that I would like to leave.
Yeah. I think it strikes me you seem very matter of fact and kind of like, this is kind of the cards we've been dealt. This is what we can do with it. Has it been difficult having discussions with family members that might feel differently? Because like you said, you were looking for other family members to let them know what had been discovered. Was it ever challenging talking to some folks that maybe didn't want to know?
Yeah, there was a family that I think thought that I was trying to sell them something. I'm not sure. I evolved over trying to reach them. They had had a terrible loss. Their father died when they were 2 or 3 years old, and they really didn't want to go back there. And he died on vacation of some, scuba diving of some kind of heart-related thing. But they really did not want to talk to me. And I wish them well. In my own family, before we knew the mutation, Dr. McNally said that I and my children and my nephew should be getting regular echocardiograms. She didn't know that wouldn't be sufficient, but at least it was something to try to find heart disease early if it occurred. And my children were young adults. My daughter was pregnant, and my son was unmarried. And my husband didn't want me to tell them. He was afraid that they'd be afraid to have children, to get married, that they would take it too hard. And he thought this was a fluke. It's just, let's forget it. Let's just move on with our life. And so we had a compromise. And the compromise was that I could tell them everything, everything I wanted to tell them in great detail, how they had to do this every year, how to, it was genetic, and I did all that, but I couldn't tell them ever again.
Hmm.
I couldn't tell them next year, did you do it? I couldn't say, oh, what was the result? I had to let it go. That they were adults, I was telling them once. And I thought I wasn't thrilled with it, but I thought that was fair. Um, and in the end, what happened was my daughter followed through and my son did not.
Yeah.
When I told them a decade later, oh, we don't have it, you can stop all this, my son said, stop what? I said, getting your echocardiograms every year. He said, oh, was I supposed to be doing that? Huh. I went to my doctor and I told him about it, and the doctor said, does your mother have dilated cardiomyopathy? And he said, no, my mom's healthy. And he said,
Yeah.
well, then you can't have it and you can't pass it on. You don't have to worry about it. The
Mm-hmm.
doctor didn't know one of the few things doctors need to know about genetics. There's not a lot they have to know. They have to know penetrance. I could have had the terrible mutation and passed it on to my son and never gotten sick because in me it wasn't penetrant. Doctor didn't know that.
Right.
So that's another thing I want to teach people about
Mm-hmm.
genetics. That
Yes.
one fact.
Yes. And I can say that it's a struggle, and also I think you having the background of being a geneticist is knowing too much or knowing more probably, right, than folks without this background. And sometimes I will say that can be a challenge for myself as well with family members when we're talking about certain types of testing or treatment. And so, I think that's an interesting approach to say, okay, I'm going to tell you, here's the information, but I can't force you to do anything with this information.
Yeah, well, one of the goals of the book is to capture people's heart. You see this beautiful, wonderful young woman with her whole life ahead of her, and for many people, it is heartbreaking to see her die. And that may change some minds. The idea that your beautiful, wonderful daughter might have to have a pacemaker or a defibrillator implanted, parents don't want to even consider that. That's too disgusting, too horrible to consider. But when they see that they might actually lose that daughter might be dead instead of alive and married and with children and loving life, and yes, having a little scar on her chest, and maybe it's having to deal with getting this thing checked every year or so,
Mm-hmm.
maybe they will change their mind.
Right. It's presenting, there are always going to be risks, and here are what the alternatives could be. Because unfortunately, especially with dilated cardiomyopathy, sometimes the first indication that we even see it's in a family is a sudden death. There's
That's
not really
right.
any other warning signs.
Yeah. I mean, we actually had warning signs, but they were ignored
Mm-hmm.
because Karen was 6 months pregnant. She told her obstetrician, I get out of breath when I climb upstairs. And the obstetrician said, every woman who's 6 months pregnant gets out of breath when they climb upstairs. But in her case, that wasn't the case.
Exactly. And you were saying that the echocardiogram is not something that could even tell if somebody had cardiomyopathy. Is there other types of screening that they recommend?
Well, I don't know about other types of screening that you would just do in general. If you were at risk, they want you to do an MRI. They want to check the arrhythmia. And if you're arrhythmia, another one of my relatives is a young man that probably now is in his 50s. When I first contacted him, he was in his 40s. And he said, he has rapid heartbeat. And the doctor says it's because he's nervous. And I said, you should check it further, but he didn't want to. So you can have symptoms and they're ignoring it. Now, if you know you have a genetic mutation, I don't think they'll ignore it as much.
Mm-hmm. True. So I think that yeah, you can get tested. And I was to say I think that's partly the passion I hear from you for the testing is that you can't necessarily ignore or potentially brush off as something else being the cause. Why do you think so many people are not getting tested, or why some healthcare providers just don't understand how common it can be to have some of these genetic cardiac conditions?
Yeah, it's very hard to break through. They still think it's very, very expensive. They think it's too expensive Genetics was a hard course. They don't remember it fondly. They think they have to know all about genetics in order to order a test. They really just have to know how you order a dress from Macy's, basically. They can get help from genetic counselors who will explain it all to them, but they really are frightened to deal with it. So there's two things. There's genetic testing for, you have a patient who has cardiomyopathy. 50% of your patients who have cardiomyopathy have a mutation. They should all be given a genetic test, and only 1% of them are tested.
Wow.
This is just negligence, and we have to change this. The other is genetic screening. I am promoting genetic screening. That is not generally agreed upon. The American College of General Genetics and Genomics does not recommend genetic screening. They recommend genetic testing. And if they find a mutation by accident when they're testing you that has nothing to do with the reason you are being tested, that's in one of 81 genes that they've picked out to be actionable, that is, you can do something about it, they say you should tell your patient. But they don't say you should screen for those 81 genes. I say you should. And they are considering it. And why don't they say you should? They say we don't have the manpower to do it. Once if you've already been screened, you have a doctor and genetic counselor in place. We don't have the doctors for follow-up. If you're not going to do clinical follow-up, there's no point finding out. And I say, change that. The other concern, the ClinGen is also not recommending widespread screening. The other concern is if the disease doesn't exist in your ethnic group or in your family at all, and you find it, maybe it won't have the same effect in your background that it did in the studies that put it listed as pathogenic. And that's possible. I think we have to consider that. But again, I don't want to throw the baby out with the bathwater. We have to be concerned if you find a mutation in the gene that affected my family that caused sudden death, and the remedy is to get frequent heart tests that are not harmful, I say go ahead and get them. If you find a mutation that's going to cause breast cancer and the remedy is to have a mastectomy, well, you might want to check out a little further before you go to that remedy. Is that mutation causing the same problem in my ethnic group? And get genetic counselors to help you with that.
Yeah, and so the first part of what you're talking about with the ACMG, I think they kind of call it like incidental findings, right? So if we're testing somebody for one thing, but we happen to find in one of these 81 genes something else, you should report that. And so it sounds like what you're saying is, well, if it's important enough to report, even if that's not why you're testing, then why shouldn't we be able to have more general population screening for those 81 conditions?
I mean, you can screen for that yourself. And of course, some of them offer it. It's not covered by insurance. It's not terribly expensive. There's a company who offers this for under $300, $295, with the doctor and with the genetic counselor. You can do it, but not everybody's going to spend $300.
Right. Well, not everybody even knows that's available or that's something they could do.
It's available. Unfortunately, when I wrote the book, I pointed to Invitae, but they have gone bankrupt, and they don't. And LabCorp, who took them over, does not provide this test. But Picture Genetics, their wellness test by Fulgent Genetics, but it's under Picture Genetics, does provide it. So trying to spread that word.
Yeah, that there's other options, even if, say, somebody were to go to their doctor and say they have concerns about it and want testing, and maybe their doctor, like you said, doesn't order it or doesn't know how to order it. There are still ways potentially that if somebody wants this, that they can find it. But of course, it's not as easy, or it's, doesn't make as much sense as just going to your doctor and having them turn in the blood work.
Well, the 81 genes are for perfectly healthy people who just want to find out in general. If you have a condition, you really need a doctor to help you find, or a genetic counselor to help you find the right panels, because you might want to get things that aren't immediately actionable. You're already sick. Maybe it just doesn't have to meet that high criteria of being totally actionable. If you want to find out if other relatives have it, there's other reasons to want to know if you're sick.
Well, and I'm also thinking too about family members, right? So somebody that's healthy but is concerned because their family member has
Yes.
started showing signs of a condition or something, and they want to know, okay, maybe that person won't get tested, or nobody's even talked to them about it, but what can I do to find out if there's something I can be doing, or screening or prevention I can be
Yeah.
doing?
Best thing is to talk the family member into it, but
That's sometimes happens, sometimes not so much. But and I've seen some, genetic counselors, geneticists that will, and I think you shared one actually in your memoir, like family member letters or some things like that, where sometimes they can provide a template or at least a start to a communication if it's something that is challenging or the family member doesn't quite know how to communicate what they've been told or what's been found on their tests. So there are other ways, even if you yourself undergo testing, to have some additional help from the care team in communicating
yeah.
those results.
One of the things I learned when I, contacted family members was that I have to begin right at the beginning saying, you might have this mutation, and if you do, there's something we can do about it.
Mm-hmm.
If I forgot to say there's something you can do about it till the end of the letter, it was not very useful.
Mm-hmm. You kind of have to hit that summary point before going into all of the
Yes.
details.
Yeah.
Gotcha. If I guess, and then the other question I do want to ask, and I did pose this, so I spoke with Greg Ruff a month or so ago. He and I have worked together on the American Board of Genetic Counseling, and he has dilated cardiomyopathy. One of the questions I had for him is, we hear a lot, I think, about BRCA or BRCA genes, right? Things to test for hereditary breast cancer. And I feel like that's been much more mainstream. We've seen it on Keeping Up with the Kardashians. We've seen it, in other pop culture moments. But with the cardiomyopathies and some of the other cardiac conditions, I just, even though it can be as common and very significant health issues, and there is some screening that can be done and prevention that can be done, you just don't hear about it as much. Why do you think there's this kind of focus on maybe more of like the predisposition to cancer rather than predisposition to heart condition?
Well, the patient who has cancer doesn't die suddenly. They have years of or months of treatment. The whole family knows about it, and it's very clear that they have a cancer. In the case of heart disease, my father died of a heart attack. My grandmother died in her sleep of a heart attack. It wasn't part of the family history. And, there are many other heart things that are not cardiomyopathy. They have a different genetic component. I mean, people have
Right.
figured out that there's heart disease in the family, but they haven't figured out what to do about it, except if they have high cholesterol, maybe to change their diet. So I don't think it's as obvious as in a family history
Yeah.
as cancer. They may be better organized, and the heart disease people are getting together and certainly using social media and trying to make it clearer. It is even that much more frightening that you could be perfectly healthy and you might drop dead. You really don't want to think about that. Whereas cancer, there are treatments. You know that if you get treated early, it can help you. It is also true with heart disease. If you get treated early, it can save you, but
Right.
you may not want to even consider it.
Mm-hmm. Well, and I think that's why, I we want to highlight, I think, with some of these cardiac conditions, cardiomyopathy and some of the others, is because there does seem to be just a lack of awareness, or that these are things that can even exist and happen in families.
When COVID came and there was long COVID, I'm involved in reading about concerns about long COVID. Of course, long COVID, and I absolutely believe that there are problems with long COVID, but it reminded me of when they told my sister that, and also one of the people in my experimental project was told that they had this because it was a complication of a flu, of a virus. Uh, and maybe there was some component of that, but basically they had it because they had a mutation. There were a number of high profile people who were dying after COVID. They recovered and then they died. And all over these long COVID, sites that I generally like and try to support, help people promote if they want to stay isolated to do that. They're very clear. They're very sure that they died because of COVID. This,
Yeah.
no young person would drop dead. How could this be? They died of COVID. Well, before COVID, young people were dropping dead, and we just, moved on. We didn't give it the thought.
Well, and I think about it too in terms of a lot of times, like in news stories where you hear like an athlete, right, especially a young athlete in the middle of a practice or something like that has that, and that's usually one of the first things I'm trying to find out is I was like, did they ever have genetic testing? Has anyone sent
Me
genetic
too. I
testing?
write to them in the newspaper. I get the names and I try to write to the publicist. And
Or put it in the comment section. And I think that's interesting that you mentioned the medical examiner of New York had, I guess, the foresight or the forethought to send their niece's heart for testing, because it's not necessarily something that's routine care, I believe, right, for medical examiners to do.
I don't know, but I do want to tell you a little more about this woman, Barbara Sampson, who was the pathologist who worked on my sister. When I called her 10 years later, she remembered this case exactly. Apparently, it's not that common for a young, beautiful, pregnant woman to just drop dead. But Barbara Sampson by then had become the first chief pathologist, I forget what they're called, but the person in charge of the New York City coroner's office. She was the first female to hold that office. So she had, progressed tremendously in that time. And she had established by then a laboratory in New York that focused on genetics and sudden death. And Yin Yang Tang has been doing genetic testing, and she's been testing. I asked her to do this years ago, and she said they didn't have money, but now they're doing it. They're going back to the remains of people who died suddenly, finding the mutations and warning the families. And she's trying to teach other coroners throughout the country and throughout the world how to save remains without destroying the DNA, so that you can do a post-mortem autopsy.
Well, and I remember there was a study, this was a while ago, but working on like, there was a group like trying to figure out, is there training or things that we can put together for medical examiners in cases of sudden death, right? What can be done? And I don't know if it was that group or a different one. But I do know, and I think you touched on it too in your memoirs, was the discussion of like DNA banking. So saving samples. And I didn't know if you could tell us a little bit more about kind of what you found out about DNA banking.
Well, there's a couple of companies who will save, I think, Security Genetics that I list in my book, that will take your saliva and save it as a DNA sample. Sometimes they put it in different freezers around the country, but this one they save it in a way that you can just keep it on your desktop. You just can't lose it. But it was like $200-$300 at the time, so it's not terribly expensive. Not everybody can afford it, but it is in reach for a lot of people. The other thing you can do is just have your whole genome sequenced now, and give that. But you have to be sure you can't get the easy analysis of it unless you engage a researcher right now.
Yeah.
Basically, the computer, HAL, will look at it with the information they've given it, and they'll spit out an answer, and you don't know what they've looked at or how they did it or what they ignored or.
And it's tons and tons of information when you do that whole genome sequencing that's like generated, and so you kind of have to use the computer, but then to filter through what's there, what's not there, but then talking to researchers or clinicians to say, well, what's there, how is it impacting me and my health, and what am I supposed to do with all this information? And I think with the DNA banking too, that's something, again, I think a lot of people just aren't even aware that that's an option. I think they think about it in terms of like cord
Right.
blood, or that it's for people that want to have access to like stem cells later, but they don't recognize, no, there's DNA banking for if, say, you're concerned about something, or if you have a loved one that does have a sudden death and you're able to get some samples and just store them for later to consider genetic testing, things like that.
I would encourage anyone who can afford it to do it, period. I mean, if my father has DNA was available and my mother's DNA was available, I would immediately have been able to find out which side of the family carried this mutation. I would have a lot more weight in talking with those family members. My dad had this mutation. Your, my uncle might have has a 50% chance. You should get tested. Than saying, I don't know if it was on my mother's side or my father's side. It took me a decade really to decide that it was on my father's side when I discovered his uncle's tragic death. My uncle, his brother's tragic
Right.
death. But before that, I really didn't know there were illnesses on my mother's side of the family too.
And I think I don't know if that shines any light, or gives you some insight into like family communication, because I think you mentioned something that makes a lot of sense, is sometimes inherited cardiomyopathy is undiagnosed, right? Because we don't necessarily know what it is. Somebody's died from a heart attack, they just died in their sleep, and people will say, okay, especially, depending on when I'm taking a family history, if you see somebody at age 50, 55 that dies in their sleep, that does seem suspicious. But there's also some families that they're like, well, I don't, that's just what it was. And I would say
Mm-hmm.
same for folks that I worked with that had family histories of cancer. They were like, oh, well, they had some sort of abdominal mass, or they had something removed. But there is sort of this, and it's not intentional. There's just a lot of families that don't necessarily share a diagnosis, or share what's going on, or their doctors can't really explain it in a way that they understand. So they think it's something else when it may not be.
And they're afraid that just the same thing that my grandmother was afraid of, that people won't like them, they won't find a marriage partner. Generally, I don't really see that. I see people falling in love despite whatever. And this can give couples an opportunity to have a healthy child. They know there's this mutation and they can do a pre-implantation genetic screening on embryos and choose a healthy embryo and not have to deal. I mean, you wouldn't do that for a minor illness. I'm not even sure you would do that for the mutation in my family, but certainly for some, Huntington's,
Mm-hmm.
there are some diseases where for sure you're going to get it and it's really, really a bad thing. You can do that. You can avoid it.
I think that's the thing, is we've moved from keeping an eye out, we're screening so it can be earlier diagnosed, but there may not be anything we can do about it, to now there are either some ways to prevent it. There's preconception types of genetic testing, like you mentioned, and or pre-implantation types of testing that you can do. So there's more, I think, that can be done now with that genetic knowledge, whereas I think 30, 40 years ago, that was one of the reasons, people were citing, oh, why test? Because we can't do anything about it.
And it was expensive. 30, 40, we did 30, 40. I mean,
Well,
even
yeah, even sooner than
15
that,
years
yeah.
ago, it was very expensive and there was much less gained. But we're there now. We don't know everything, but we know enough.
Right. And like you said, like knowing you can find out some answers. You may not always find out some answers, and you kind of have to get kind of comfort around there might be some uncertainty, but the benefit may be that you find out things that are more concrete or actionable. Is there a way forward in types of like inherited cardiomyopathies to make it more known, or how help people have more testing? Like, is there things that relate to guidelines, insurance coverage that can be done to potentially increase uptake of that?
I think the insurance covers it. It's a matter of educating the physicians and maybe the patients so that they ask for it. And I mean, perhaps more stories like mine will educate the doctors, and I do think this consortium from the cardiomyopathy societies, where they have a social media outreach where they are trying to reach physicians and patients. It's just a shocking statement that many of the different, not just cardiomyopathy but several other heart diseases, large number, 50% or more, or a large percentage of the people who have this disease have a pathogenic mutation in something we know about, and we're not testing them. It's not like their families don't know that there's something going on and that we're going to make them nervous. We could relieve them. Your father had this mutation, has cardiomyopathy, he has this mutation, and look, you don't
Right.
have it. Forget about it. Or you have it, get yourself tested. Avoid it in your children. But we can give you medicines as soon as we find it. We can implant a defibrillator so that you won't suddenly die.
And I would say, I think that's kind of the take home message for me, was thinking about, with hearing your story, hearing about your family, especially with your nieces. I think, like you said, is here's the alternative. And it was something that was completely unexpected and sudden, yet knowing what we know now, wouldn't you rather do something than have this be the risk that you're taking with a loved one?
Your daughter. Yeah.
Exactly.
Yeah.
Are there other things that you hope that people either take away from this conversation, or things that you want to make sure that we talk about with the memoir? And I'm looking at it because it's over to my side. Other things that you want to highlight in the memoir?
Well, one of the minor messages is that women can do anything, and that science is a great career if you, or any career, that women and men and children, you can do anything. So and that parents that love their children open up things that may not be, my sister, each of my family members had their shtick. So my sister's shtick as a teacher was celebrate your child. Stop complaining that they're not a football player. Stop complaining that they're studying all the time. Stop complaining they don't have A's. Celebrate your child. Find what they're good at and celebrate it. And so that's one message. My father's message was learn to be satisfied. If you didn't have an earthquake, if your father didn't drop dead today, it was a good day. Enjoy that day. Be grateful. So those kinds of messages. My mother's message was more, you come home and complain. She'd say, this too will pass. Wait till tomorrow.
Yeah.
And she used to say, all the things you're worried about, none of them are going to be the problem. It's the ones you haven't thought of. And that's what happened to us.
I think that's very true. It's some of the unexpected.
Yeah.
Well, I appreciate you spending time with us today. Like I said, is there anything else that we wanted to go over? Any other last minute things that you wanted to cover?
Yes. Now that you mention it, there is one little technical thing. So I know we were near an end, but it used to be that physicians would say, well, you smoked. That's why you have cardiomyopathy. You have diabetes. That's why you have cardiomyopathy. You're an alcoholic. That's why you have cardiomyopathy. Finished, the end. Well, those things do cause cardiomyopathy. But 1 in 6 people who have those things also have a genetic mutation. So they shouldn't it's not 1 in 2, it's 1 in 6. But it's worth testing them, that you can save their families. So the things work together. The mutation and these other factors make it more likely you'll see this cardiomyopathy. You could have it without a mutation, but often it has a mutation, so that doctors need to know that and should be testing their patients. And it's not expensive, and it's not hard, and they don't have to have love genetics. A genetic counselor can help them.
Yeah. Well, and I will say, I think that's one of the things too, is you don't want to be dismissive, right? Because you're like, okay, here's a factor, here's a thing that can cause it, but that doesn't mean you just dismiss the whole thing. So part of it's looking a little bit more to see, yes, is genetic testing needed? Is this something? And don't just write it off as, oh, this person maybe had a lifestyle factor that wasn't great or that was detrimental to their health, and that's it. There's nothing more to that story.
Mm-hmm.
Mm-hmm. And I will say that's the other one when I would teach medical genetics to med students is just call a genetic counselor. You don't have to know
right.
all the ins and outs. It's totally okay.
Yeah. Yeah, just refer.
Yeah. Yeah. Well, I just, again, appreciate you so much for taking the time and for being here with us today.
Well, thank you so much, Kate, for inviting me. I had a great time talking with you.
For more information about this episode, visit allaccessdna.podbean.com, where you can also stream all episodes of the show. This link is also in the show notes for easy access. Any inquiries on the podcast can be sent to allaccessdna@gmail.com. Check out our Patreon at patreon.com/allaccessdna and consider donating to get bonus content, submit questions for our guests, and connect with other genetic curious individuals. Note that this podcast is for entertainment and education and is not intended to be a substitute for professional medical advice. Please consult your physician with any questions you may have regarding your health. Please rate and review the podcast on Apple, Spotify, or wherever you listen. This helps other people like you discover the show. All Access DNA is hosted, produced, and edited by Kate Wilson. The logo design is by Designs by NKJ. Thanks for listening, and join us next time.